Well, welcome one and all to the effectively June meeting of Healthwatch West Berkshire, which we slightly rolled over onto the 1st of July for various reasons. I was trying to work it out, and I think this is probably the 5th meeting we've had virtually. So we're sort of getting used to it, but equally we're looking forward to hopefully being able to meet in public before too long. I will actually whiz through the introductions. Most people are known, but so if you just hold on while I call your name, and then you can just introduce yourselves. I'm going to do it in the order it appears on my screen. So Michelle.
I'm Michelle Pace. I work for Healthwatch West Berkshire as a digital admin officer.
Martha.
I'm Martha Vickers. I'm one of the board members.
And Adrian.
Adrian Barker, one of the board members.
Amanda.
Amanda Cunnington, one of the board members.
Alice.
Hello everyone, I'm Alice Clifton. I'm the engagement officer.
Andrew.
Andrew Sharp, Healthwatch West Berks Chief Officer. Good morning, everyone, or afternoon.
Afternoon.
Morning, I'm Karen Swaffield. I'm a board member.
Leslie. Leslie.
Yes, sorry, I couldn't get myself off mute. I'm Leslie Wyman. I'm one of the board members.
And Nathan.
Hi everyone, I'm Nathan. I work at Healthwatch West Berkshire as a digital and social media officer.
And I'm Mike Faraday, the chair. So if we move on to item 2, apologies for absence.
Paul sends his apologies.
Could you give his full name, please, for the...
Paul Wilson, board member, sends his apologies.
Thank you very much. And do we have any declarations of interest that are new? I don't really want to go through the ones that exist.
I'm a trustee of loose ends now. I don't know if that makes a difference.
Okay, we'll record it. Right, thank you. We'll move on to item 3, the minutes. Everyone has had a copy of the minutes. Are there any alterations or errors that you would wish to record? I don't propose to go through it page by page. Anyone got anything? No? Okay, thank you very much. Before we move on to the matters arising and the action log, I just wanted to say that we are going to have a presentation from a Hampshire Healthcare Development Foundation Trust about their plans to redevelop Hampshire hospitals. Normally that would have taken place at the beginning, but for various reasons it's actually going to take place at 1:30 or thereabouts, so please bear with us. Right, matters arising. Andrew, is there anything you...
I haven't got any matters arising, but we probably need to quickly look at the action log, don't we?
Yeah, okay, let's move to the action log then. Quite a few things ongoing. Item...
Oh, we've got two items 9s again.
Yes, we do indeed. Let's take the first one.
Okay.
Thinking Together 5.
Yes, so that's been done, and we are waiting for final responses, Adrian, and then I think we can pretty much publish the report. Yeah.
Yeah.
Excellent. Have we had any responses?
I think we've had a few.
Yeah, it's not very many. A handful.
Okay, right. Thank you. So that is ongoing for the moment, but will be shortly resolved. The next item, which unfortunately is also called 9, Contact and Issues Report, Voice of Disability. Paul suggested a steering group was set up. What do you wish to comment on that, Andrew?
I do actually, because I raised this at this morning's Health and Wellbeing Board when they're talking about the new 10-year strategy. And one of the things I sort of pointed out was that the Voice of Disability report highlighted that disability is often left off things and seen as an afterthought. And Kamal also raised the fact protected characteristics are often left off or added in additionally. So it's a shame Paul's not here today, because I think this is one of the projects that needs as much full board support as we can possibly get, because the current West Berks Disability External Scrutiny Group has been championed for many years by Nick Carter, who is stepping down as Chief Executive Officer in August. And I haven't heard what's happening with it. So I'm still of the opinion a new group needs setting up that should report to health and well-being. But I think the board needs to support Paul as much as possible, so it's not just left to him. So I think that's all I want to say on that one, Mike.
Okay, thank you. The next item is the work plan, item 15. I'm
a bit disappointed with this, because I thought we'd discussed this internally. I'd come back with explanations of questions, and as far as I was concerned, it was finalised. So I'd like to take this offline and get this agreed this week.
Well, I also was of the view that it had been sorted out, so by all means, but hopefully I don't want to see it hanging around. I'd like to see it finalised this week.
Excellent. Let's do that.
The next item is item number 6 from.
Again, it's on the agenda, so I think let's pick that up there.
And we have number 8, quality framework. That is still ongoing, Andrew, isn't it?
Yeah, I think now we've got the annual report out of the way, I think, again, this is one of our priorities to make sure we've got this moving forward. It's also helpful that the chaps at Healthwatch Portsmouth are now part of the advocacy people, because they're a bit further along with this, so they may be able to give us some assistance. But again, we do need to now give this some priority attention.
Excellent. Okay, thank you. And the next ongoing item.
This should really have been done, but we just need to pick up the 2 contact points, unless someone's got specific contacts within the organisations. So let's just get those sent out by the end of the week.
Yep, excellent. And then the next item needs reassessing.
Yes. I think what I'd like to do is invite the West Berks Learning Disability Partnership Board to see if they can help us with this, because as it stands, we try our very best to do all our reports in easy read. As it stands, we've got the COVID report is outstanding. The annual report needs doing, but we need to get those done in easy read. And also the forthcoming CAMS and Thinking Together reports should probably be done as well.
Okay, right. And that I think is all of the outstanding items, is it not? So we'll move on to item 4, which is the report of the Chief Officer.
Thanks, Mike. I'm going to keep this blisteringly short, hopefully, because not nearly all the things I talk about are on the agenda. So rather than listening to me, I think the only thing I just want to highlight is obviously, even since the last board meeting, lots has moved on in the country. The health services in the throes of COVID recovery, but that recovery is patchy. It is very different depending on which discipline it is we're talking about. So if you're talking about physical elective operations, there's lots going on and lots being done to mitigate waiting lists, although the waiting lists are the highest they've ever been. We shouldn't overlook that, and also the effect and impact that's going to have. But I think it's often the hidden services. The memory clinic has got a 10-month waiting list, and bearing in mind for dementia diagnoses where the likely survival rate is 5 to 7 years, to have to wait that length of time before help impacts. And very, as we found with children, adolescent mental health services, the diagnosis seems to be all, and the help you get seems to be very limited until you get this magic diagnosis. So having this massive weight in services like that is a real concern. I'm sure there's a host of other services that equally aren't getting the attention that, you know, cancer non-electives are, that often hit the headlines. So that's a watching brief. ICS is up in the air still, but we'll cover that off later. Obviously, the other big changes are Simon Stevens is stepping down as chair of NHS England. I've sent him our annual report. I've also thanked him for what he's done for the NHS over the last number of years, because I think he's done a pretty good job considering the state of play. And I think the NHS, although with COVID and funding challenges, is in a slightly better position it was when he took over. And of course, we also have a new Secretary of State who we know nothing about, apart from his banking expertise, which I'm sure will come in desperately handy. But let's see whether or not this social and green paper ever turns up out of the oven. I'd like to thank the staff, especially the board, all our volunteers, for continuing to do just tremendous work in really difficult circumstances. We continue to play a key role in feeding back patient information and are still raising issues around dental vaccination inequalities. And obviously, I'm really pleased we've got a presentation today from Hampshire hospitals about their potential redevelopment, and I'd like to see similar from Royal Berks when they're a bit further along. So delighted about that, and I think the rest of the agenda speaks for itself. But I did just want to highlight, especially Alice has done some amazing work in keeping things going, and the Great Western piece I think is remarkable. But we'll find out a little bit more about that going forward. And the annual report is in as per our statutory requirements. Apologies for sending you all the wrong version. And apparently Bal was not the chair of the Health and Wellbeing Board, as Graham Bridgman pointed out to me today. So at least he's read it. He was vice chair, so that's good to know. But hopefully you've had a chance to have a quick look at it. That's all I've got to say today, Mike. I think there's lots on the agenda to get through.
Okay, thanks, Andrew. I think Amanda had a clapping hand. That was a symbol, isn't it?
Oh, Mike, unless you were going to cover it off, we obviously owe a huge debt of thanks to Judy. So
Indeed.
if I can pass back to you on that one.
Yep, indeed. For those of us who are aware or unaware, Judy is stepping down from activities with the board and volunteering. Karen, and I too would like to add my comments. I have already sent her my comments, but I would like to actually publicly say that she has done a fantastic job. Karen, would you like to?
Yes, Andrew, you say that, and we know that there's slippage and that there's a long waiting list for mental health and for CAMS and Alzheimer's assessments. Could we not lobby for them, if they can't make the assessment and then treatment and support doesn't come until they've had the assessment? Can we not lobby for them to put something in place, some support in place before there's an assessment? Because it does seem that it's going to be quite a delay. And as you say, for people, it's quite a major thing.
Yeah, I mean, I'm delighted that Fiona's here from Age UK Berkshire, who really are the specialists in this. And I'm hoping we've got some joint work to do in coming months. But I've already raised this at the Mental Health Board. I will raise it again at Health and Wellbeing Board, because, as I said, we've got health inequalities boards turning up everywhere. But as Michael Marmot said, health inequalities and health iniquities are two different things. And while you can spread a service out equally, it doesn't mean that the people receiving it are getting equal benefit. And that's what we've got to watch, and what we should be pushing is to get rid of this. And this hang up about the diagnosis before help. So we will be raising it both at primary commissioning, mental health boards, and the Health and Wellbeing Board, hopefully with the help of organisations like Fiona's who do just a sterling job. Who knows, they might listen.
Okay, thank you very much. I just wanted to say, Andrew, that both Adrian and I were at the PIP AGM last night, and there was a presentation by Nikki Lloyd and a colleague on the Royal Berks development. I did ask a question about public engagement, likening it to Hampshire, and I think the response was that Hampshire's redevelopment was somewhat different because they were changing the way the various hospitals deal with particular conditions as opposed to RBH, but they will be going into the engagement mode shortly. I think I got that right, Adrian.
Yeah.
Okay,
I think again, it's something that as we're getting Hampshire here today, we should either look to do the same with Royal Berks, or potentially even look at doing a bigger open public meeting, maybe.
Yeah. Okay, fine. Right, thank you. We'll move on to item 5, COVID-19 care home visits. Alice?
There's not much of an update for that. It's still ongoing. So hopefully once we are out and about, we will start doing that again.
Alice, could you just detail what we've done so far?
Yes.
Oh, yeah. So far, what we've done is we've visited 3 of the council care homes, and that was during the COVID time that we were allowed to visit. So I've done 3 of the council homes. So No Trace, Birchwood, and is it Walnut? I think it's Walnut is the other one that I've done.
How many more to do?
Sorry?
How many more to do?
But the things that the next lot are the private ones. So I'm hoping to do at least about another 4 or 5 at least to do a comparison.
Well done.
Thank you. And it's you again, Alice, for the next item, item 6, the visit to Great Western Hospital.
Okay, just to say that this has been on the Great Western Entrant View has been ongoing for a long time, and this is based on the CQC report that they have been rated as requiring improvements. So the hospital chief Kevin McNamara and us as Healthwatch have been having a conversation about to see whether we can work together and see whether we can find out what the public feels about the hospital. So this has been over a year's work. So it's finally happening now. So today is the launch of the survey. So today at 10 o'clock, the survey has been launched. So what we would like is the public who use the Great Western Hospital to fill this survey. But they have got to be, if they've used the survey from July 2020 to July 2021. Then on next week, from the 5th of July till the 11th of July, we will be visiting Great Western. But either, there are 2 ways we are doing it, face-to-face, and then also virtual. We also are doing telephone conversations with those patients who've been discharged. So that is our project for the whole month of July.
Okay, thank you, Alice. Martha has a question.
Yeah, just about the survey. Obviously, people from a quite wide-ranging area use the Great Western. We know quite a lot of local people who go there. So yeah, it sounds as though you're doing your best to publicise it. So it's going online, and obviously quite often now that's where most people go for things, don't they? So are we doing anything else just to sort of get the message out that there's this online survey? Oh, what's happened?
That's the survey kind of thing. So we are it's online, it's on our website. It's going to go through social media, so all the social media platforms. And if people require a paper copy, we are happy to send it to them. And also, we are happy to help them as well.
Are we putting something in the paper? I know.
Yes, yeah, we are doing a press release as well. So
Okay.
that's
much
going
as
to
we
happen soon as well.
Okay.
So we are trying to and the other thing is also what's been very good is the chief nurse of Great Western have also put out a video encouraging people to embrace this survey as well. So we've been working, and we will also do the same to try and work together. So it's been a good collaborative work.
Okay, thank you.
Okay, thank you, Alice. I suppose it would be expecting too much for Great Western to have actually contacted those users of the emergency department and highlight this survey.
Yeah, they have. I mean, what they're doing is also, we've also got posters up there as well. So I mean, they have really pushed it out. So the wards we are visiting the emergency department and also the 2 medical wards and 2 surgical wards. So,
Fine.
I mean, the thing is that we will be doing the virtual, which is also something very, very new. This is very, very new for all of us. So, but that's been tested. So, I mean, this work has been with Healthwatch Swindon and Healthwatch Berkshire. So, so we all are having the same messages going around.
Okay, thank you.
Andrew's got his hand up, Mike.
Sorry, who has? Sorry,
And Andrew.
Oh, he has. Sorry, it's hidden among his rainbow.
Yes, sorry about that. Yeah, no, I just wanted to highlight how pivotal and important this piece of work is. Healthwatch England are watching this because it's really taking Enter and View into a sort of more multi-dimensional level, because you used to just turn up in person, and we just don't know going forward whether that's either going to be likely to happen as it did prior to COVID, or we have to come up with these hybrid versions. I absolutely accept Martha's challenge to us getting surveys and information out to people who don't have access to digital. It's really, really important at the moment. And I'm hoping we have got a plan to get information out via the parish councils, via Hungerford Town Council, etc. Because obviously 90% of the residents of that area use Great Western in the way that lots of people in the other side of the county use Royal Berkshire. So this is a huge opportunity for the people in the west of West Berkshire to get involved, let us know what they think, let the hospital know. And I just want to praise the hospital. I think they've just been remarkable. It's often something you find where if a provider's had a bad CQC rating, they close up, they close ranks, they get very opaque. Great Western have done exactly the opposite and said, come tell us what's good, what's bad. We want to know, and they really should be praised for this. So what we're really hoping is that the other hospitals, so Royal Berkshire, Hampshire hospitals, who we can ask later, I suppose, and John Radcliffe, look at this as a model of how things should be done. I'm delighted we're working with Healthwatch colleagues in Wiltshire and Swindon. So this really is a significant piece of work, and obviously, Alice has underplayed her role in all of this, which has been remarkable. So again, it's lovely to see Healthwatch West Berks, one of the smallest in the country, coming up with innovative ways of utilising our very, very limited powers of entry into places. So if the board can support Cascade, let anyone they know in the West about this, that would be brilliant.
Thank you, Andrew. And I agree that Alice has done and is doing a great job in this particular project. Right, okay, thank you. We'll move on to item 7, which is the coronavirus recovery, the COVID-19 survey and report. Are you leading on this, Andrew?
I think I'd better had. So we took the report finally to Health and Wellbeing in May. West Berkshire Council, who demanded a response, sent it to us 24 hours before the meeting. It was about 14 pages long and wasn't, I think, the response we'd hoped for, and certainly was very different to the very positive response we got from Public Health England, from Health Education England, and in fact from Sir Simon Stevens' office and the CCG and ICS, which, while not necessarily accepting everything as recommendations, could see where it was going and what have you. So, as I said, a little bit disappointed in West Berkshire Council being again quite defensive rather than looking at it. But what was a real positive of the meeting was that it didn't turn into a sort of bun fight of opinion, and it was universally accepted that, you know, with a death rate higher in West Berkshire than the whole of Australia, perhaps the pandemic could have been dealt with in a slightly better way. And, you know, I think this is true of the whole of the UK. While we, you know, lots of it was brilliant, you know, the frontline medics, the key workers, the community response was just tremendous. There was lots of things we didn't handle well, which probably goes back to pandemic planning for a flu outbreak, which this wasn't. So failure to prepare ends up with where we are and where we still are. So what I'm really hoping and pushing for is that Councillor Bridgman felt that, you know, what really would help is a follow-up to the report from both the second and third wave. So we almost ask very similar questions and almost produce a similar report saying, well, that was basically the first wave and just post first wave. Well, where are we now? And then we also challenged the council leaders to actually take the learning on and say, where are we going to put this learning? Not just from us, but from other partners. So I'm really hoping a serious piece of work develops from this so that the really important COVID learnings aren't lost in the midst of, you know, the success of vaccination and what have you, so that when and if this happens again, you know, we are better prepared. We know how to deal with things. We know what the priorities are, and we don't close off services like phlebotomy or memory clinics or, you know, so many others that were just stopped in their tracks. You know, we have to mitigate things, and we have to make sure we look after our vulnerable, and we don't just do it on the basis that it says care home outside that building and we'll help, and supported living outside that building and we won't help. You know, it's about the people who live in them and how vulnerable they are, not the name of the building. So I thought the responses generally we received were really, really positive. We've put them in the report. It's available online. And as I said, I think, you know, it's up to us and the board to make sure this does not get lost and left on the shelf, and we keep pushing to make sure things are learned. Thanks, Mike.
Okay, Martha?
Thank you. So I'm just getting messages saying my internet is unstable. I don't know why. We're supposed to have just improved. So apologies if I disappear. It won't be my fault. Yeah, my question is really related to, hopefully came up in the discussions, that is one of the issues, probably what's happened with management of COVID is, to begin with, there was not enough local control of managing the pandemic locally. I think that sort of got a bit better towards, you know, the subsequent lockdowns. But is that something that was discussed, that if we had more local control, that, you know, you'd be more responsible for what happened in your area? Was that something that was? I
think the only probably disappointing feature of the meeting, which we highlighted heavily in the report, is the central control of communications created a real problem, because often there were just completely blank bits left. So there was no dental information until almost the end of June, and it wasn't very helpful. People didn't know what was happening with everyday services, and the local NHS comms and local authority comms weren't allowed to say things. So I think this is one of the key learnings that will go in. But I think it kind of got missed because of the successes of the community hub, which did work really, really well eventually. But it was more the community, I think, took the reins up, and then the national stuff followed on with that. I think Adrian had his hand up as well.
Sorry, no, it's all right. I was just wondering what the sort of response from the council was, but I can read it in the report.
somewhat disappointing.
I was going to call you in, Adrian, but then your hand disappeared. I wasn't quite sure whether you were still okay. That's fine. Sorry, Andrew, you got anything else to say?
I don't think so. As I said, I think the only thing that really did that I thought was a real highlight was the fact that the report was very well received, largely speaking, and certainly by some significant bodies. And I think it does show, and I just need to underline this throughout the meeting, that if people feed back to us, and especially anything we were pulled up for was the significance of the numbers, and yet the actual numbers taking part, relatively speaking, was quite high, considering we weren't given the channels that other statutory bodies get in terms of communicating with the whole population, and the fact we were locked down and couldn't get out and about. So I thought that was almost a non-argument. If L'Oreal are happy to send out a national advertising campaign that 45 people have taken part in, well, if we get 300 plus who've taken the time to answer all the questions, I think it should be considered important. Yeah, so as I said, I think it doesn't finish here, and we should be looking at following it up. Leslie's got a hand up, and she is the absolute expert on this. So over to Leslie.
Yeah, I wouldn't say I was the expert, but just in following on from what Martha said in terms of local control versus central control, I think that a huge lesson was learned around the use of public health teams in local authorities and local public health consultants. Initially, they weren't really involved. They weren't given the local data that they required. And once they got it and got their mojo going, I think they did a fantastic job, and I'm sure that will continue, actually, depending on what happens to public health in the future. But let's hope it does anyways.
All right, thank you.
Karen's got a hand up.
He has, yes.
I'd just like to say that I think that given the size of Healthwatch, the reports that have been done over the last couple of years have really been quite tremendous. I feel really quite proud to be involved with the whole organisation. So I think you've done really well.
I would certainly agree with that. Amanda?
Yeah, I was just going to build on Leslie's point, really, that the local coordination through the public health directors and public health at a local level has been really, really crucial. And I think it has been recognised. If you read the HSJ, you see it as well, that people are recognising that is the link that was needed to be made, and it got made. And therefore, I do really think that Healthwatch, as we're kind of looking at the evolution of the healthcare system, the announcements around the changes in Public Health England, and I think it's important that we continue to look at where public health is sitting and their ability to be strategic and be able to operationalise fast as we go through. So I think it's something that Healthwatch should continue to kind of keep quite a close eye on, because I think they are the people with the strategic view of population health.
Thank you, Amanda. Okay, then we'll move on to the next item 8, Contact and Issues Report, the first of which is Thinking Together 5. Are you kicking off with this, Andrew, or is it Adrian?
I think Adrian can probably kick off on this.
Yeah, I don't think there's much more to say, really. We've the report of the event from last November is finished, and it would be ready to go, but we wanted to just try and update it because the experiences that it's based on were just from the first lockdown, and we thought things may well have changed since Christmas, so we were trying to get a bit more feedback. As I said earlier, not very much so far, but we'll use that and then go with it. I think the next stage is that the Mental Health Action Group, which is a subcommittee of the Health and Wellbeing Board, were keen to see it because of the subject matter and because they help fund the Thinking Together events. So I think it will go there. And I think it'd be useful to get some feedback from the various bodies to which recommendations are made. I think one of the comments, I think it was something that you said, Mike, was it's quite difficult to get recommendations from some of the things in the report, because people were saying, you know, this is what happened, this is wrong, but not necessarily this is how you fix it. So we had to sort of take a bit of a leap and say, well, here's what we think might be needed to fix this particular problem. But I think it's worth having that as a dialogue with the CCG, Berkshire Healthcare Foundation Trust, whoever, to make sure that, you know, we're recommending things which are sensible. And we might be able to steer what they're possibly thinking of doing anyway, rather than trying to completely change their direction, because I'm sure they're aware of the same sorts of issues. Okay, thank you. Oh, Andrew?
Yeah, I just wanted to follow on with that, because it was discussed at Health and Wellbeing Board this morning. So not only the report, so I think we need to get that out to the Mental Health Action Group today, tomorrow, for comments, so as we can get the report published, but also the next Thinking Together. There was discussion at the next Thinking Together event, which we probably should have held now or in the very recent months coming up, could actually almost be one of the first events to dovetail with the new joint health and wellbeing strategy, where of the 5 priorities, 2 of them are mental health. One's adults and one's children's. And we had talked, and I think it's something we really should progress, is an event that is more related to either children or adolescents, and whether that's with them themselves or with their parents or both, because Thinking Together so far has all been related to adults only, and the real worries that seem to be coming through with the problems of education and lockdown and Lord knows what else is the effect it's having on younger people. So I think working with Berkshire Youth, Time to Talk and various other bodies, we should really be looking at the next Thinking Together event, having a look at this, and whether we almost relate back to that first event we did back in 2016, where we didn't really have too much in an agenda apart from come tell us. Perhaps that's what we should be doing, but we should get that planned as soon as possible and hopefully get it in the diary for September, October.
Martha, you?
Yeah, I couldn't agree more. I mean, particularly the more we're hearing all the time about the effects of COVID on our young people. I mean, they've basically been sacrificed to try and keep some of our elderly alive. And I just think it's all the wrong, really. They're really, really suffering. So I think making them a priority is really important. And Alice has been participating in an initiative of the town council to try and get in touch with our young people. And we had a little sort of like a mini youth conference just last week, where mental health was one of the things that we were discussing with. We had about 10 young people, but we just had a very small, we had a youth worker from Berkshire Youth, someone from Time to Talk, their youth worker, and a representative of the town council. And we're hoping to continue that dialogue. So it might be that, if there's anything, that Healthwatch is organising, we can possibly, at least we've got a little link with some genuine young people. And of course, it's going to be great going forward, and hopefully they're going to be up and running before the end of the year. Yeah.
Okay, thank you.
Alice, you wanted to come in?
Yeah. I just want to say that what would be worth is looking at the report from the that was done by Berkshire Youth and also the Newbury Town Council, and then work from there to look at the outcomes and see, work with the young people, because we don't want to repeat the same thing.
I think we've also got an opportunity to work with the other voluntary sector and the children's delivery group as well. And also, again, this dovetails so well in with the joint health and wellbeing strategy. We should be pushing at some open doors here, but equally we need to get the voice of young people into this.
Could we go into schools? Could we go and speak to staff and also to children? I mean, we might be able to get into tutor groups in the schools, which would be very useful. I don't know if that's been done.
Well, potentially through the Children's Delivery Group, and also there's the fabulous Youth Health Champions scheme, which is still running, which doesn't often have an outlet. You know, it does some really great stuff, but the students who take part in it, it doesn't always have an obvious out. So this could be something here. So I think with the work that the Town Council have done, Berkshire Youth and our various other connections, I just think we just need to maybe hone our focus in and just say, right, we'll pick a date that's suitable for the stakeholders, get the young people involved and just get on with it and do it.
Martha, what we might miss though then would be those people that don't want to talk, the underprivileged kids perhaps, or who are finding it particularly hard, who don't have a voice.
I think we've got to go find them.
Martha, did you wish to come in, or did you put?
Well, I sort of put it off again. I mean, I think Andrew's more or less covered it, but there is quite a lot of good stuff going on through the council, the district council, within schools that I think we don't always hear a lot about. So obviously Andrew's aware of that, I think. So just don't forget that as well. There is stuff already happening that we can use.
Okay, thank you.
Okay. Mike, can I pick up VOD because Paul's not here?
I was going to ask whether there was anything to say on that.
I think we've kind of covered it off really, but Voice of Disability in theory goes back to the Health and Wellbeing Board in either September or October. I think I've asked them to put it back, but I'd have to check whether it's to September or it might even be the November meeting, because we're expected to do an update on what had happened from the report from sort of a year plus ago. And this is where Paul was trying to get his steering group together to both look at each recommendation and also speak to the various bodies who were asked to do things. And I think it's such a huge opportunity. We need to get it right. So if it has to be pushed back, then fine. But if not, but as I said, we do need to give Paul as much support as possible.
Okay, thank you. Leslie, I guess it's down to you for CAMS, is it?
Yeah, really, it just links in with everything everybody's been saying, that the CAMS survey and report. The report's nearly done. We had some helpful feedback from Amanda, Judy, and Adrian. So I just have to incorporate what they've said into the report, and then it will be done. But I mean, it just really fits in very well with all of the work that we need to be doing around mental health and young people. So I think all that I would say about it is, I think it's going to be tremendously important going forward with this report, and how it's presented to commissioners is to ensure that we make sure that they understand that we know that they've been trying to fix CAMS for many years, and all of the loads and loads of work has been done. I have mentioned it in the report. I think we have to keep reiterating that, because it's exactly the same. The message is the same message that's been going out there for a long time. It's just that they don't seem to have gotten anywhere. So it's about joining with what's already being done, and really supporting the work that's going on, and trying to, as we all want to do really, is to bring in the statutory sector and also the voluntary sector, so that we're all working together for this end. It's tremendously difficult, and there are so many complexities, even to things like, well, yes, we all realise that we need more staff, and it's okay, the government can give more money to get more staff, but actually there's a problem with local recruitment and we can't get the staff we need. So it isn't just that simple. I think there's just very many things. So I think it's really exciting that it does appear to be all coming together, actually. And I think we could have an excellent event, as you say, that includes looking at CAMS as well as one of the issues.
Amanda?
Yeah, I mean, I think it was a really good report, and I think it chimes so well with a lot of the other things that are being kind of stated, but this is an ongoing problem. And one of the bits that I was reflecting on, and I fed into Leslie, is that I was really shocked to see that West Berkshire is going backwards in terms of its position in terms of CAMHS access. So we're one of the lowest 10 CCGs in the country in terms of deteriorating CAMHS access. So, and this is from the Children's Commissioner report in March, I think, this year. So the report has a lot of recommendations, but I think the key one is this access piece. And if this was a physical condition, it would have far more attention. And I think we just need to just shout about this an awful lot, and not at the people that are trying to solve it, because I completely agree. The people who are in the system are trying to solve it. It's just trying to work out how we can come at this from a different perspective, because it is really concerning that we in West Berkshire have this deteriorating position.
Yeah.
And Andrew?
Yeah, just coming back to this, because it's really interesting that at the Mental Health Board, there was actually this acknowledgement that for the first time in a very, very long time, there is actually significant funding coming into mental health. So to give you an indication, there's something like the mental health budget for BHFT in our CCG area is about 63 million. And I think next year they said they were getting an extra 5.5 million. So that isn't going to answer everything, but that is a significant chunk. But as Leslie quite rightly pointed out, and I raise it at almost every meeting, we have so many posts unfilled in mental health. We have so few that if you recruit, you pinch someone from somewhere else. And what COVID has done, and we did put this in the report, we have a generation of young people who are now without careers because retail has changed forever, hospitality may have changed forever. And there just doesn't seem to be this connection made with, if you work in health and care, you will have a career for life. And instead of it being the sort of the last choice from the careers service, well, if you can't do anything else, go and do this. You know, we need both as providers, commissioners, organisers, and people within the health sector to be selling this as a really positive thing, because society benefits, the people who work in it benefit. And as I said, you know, you will always be needed, but we cannot just rely on pinching staff from one organisation to another to fill posts. And also, I think, you know, you do question the strategic planning on, you know, the policies announced before they work out if they've actually got anyone qualified to fill the posts. You know, you cannot just come up with, you know, trained mental health practitioners overnight, and they know it's been a problem for some time. So I think there is some failings in connection here, which I think we should carry on pointing out. And I think we equally need to keep working with the mental health voluntary groups to keep pushing on this. I think when and if the CAMHS report comes out, we should try and do some more in terms of media and see if we can get a little bit more attention. Our local MPs taken an interest, which is good. So there are lots of positives to be had, but it's about, let's not miss another opportunity. The other thing I just quickly wanted to say was a huge thanks again to Michelle on this work, for both partly being an instigator of this, working with the focus group, working with the parents and what have you, and helping put the survey together. So everything is always a team effort. But it's important that people realise that the folks who work at Healthwatch as well have got, you know, they're involved in the systems that we're talking about. We all live here. It affects us on a day-to-day basis. And it may not be lots of people, but it's very real for all the people who are going through the system. So if you think we had 130 plus responses to that survey of just people in West Berks who've used CAMHS over a period of time, that's a lot of people. That is an awful lot of people. So we really do need to make sure that Leslie's absolutely right. We get the tone of this right. This is not about beating people over the head. This is about saying, we know you're trying your best. Is there a different way? Can we try some other things? Can we do things so that at the end of the day, our young people and their parents benefit from it? Thanks.
I agree. Okay, thank you. The Joint Health and Wellbeing Board Strategy Consultation, Andrew, do you want to say anything on that?
Yeah, let me just pick this up. This has been a fabulous piece of work over the last 12 months. It's brought together 3 local authorities. It's brought together CCG, and it's launched now. The consultation on the 5 priorities are live now, and they run till the 4th of August. We've got it on our website in terms of feedback from it. I think it's a really good document, and again, it got discussed today. And the only sort of worry for the folks was that the statutory bodies won't play nicely together, because the word joint is where everyone wants things to be in terms of, well, of course it should be integrated, but people can migrate back to their silos. And I think we're very, very lucky in West Berkshire that the level of joint working is considerable. It's generally quite effective when it's done. It's just getting harder as the landscape changes, as areas become bigger. So our integrated care partnership is now Berkshire West, which is Reading, Wokingham and West Berkshire. Our integrated care system is Berkshire West, Buckinghamshire and Oxfordshire, which is huge. And it's trying to have some genuine influence where you need to, whether it's Aylesbury or Bath Road or locally. Adrian, you've done lots of work on this, so if I can pass over to you.
Yeah, I'm not so enthusiastic about the document as a strategy, which you will have heard me say before, so apologies. But I don't think it is actually a strategy. But on the other hand, I think the priorities are good ones, and I think it's good that they've managed to get those agreed. And I think it's well worth giving some thoughtful responses to the consultation, not to say this is rubbish because it's not a strategy, but to say great priorities, but how are you going to make sure that they're implemented? How are you going to be held to account on them? You know, think that the boring bit at the end, the performance indicators, is worth a close look, because I don't think those are things which really are a good measure as to whether it's being achieved or not. And just to say this is a priority, it's important, it's very difficult then in 3 years' time for us to say, well, you said this was a priority, why haven't you done anything? And they'll say, well, we did this, we did that. But, you know, there's nothing that you can sort of judge them on properly. So I think it is still well worth having a good look at it and seeing how we can take it forward and make it sort of meaningful.
So let's ensure the link goes in the minutes, and although it's on our website, it's in our social media, we'll obviously be putting it in newsletters and things like that. There was quite an interesting point this morning that as only local government could do, although it's a joint strategy, each local authority is also doing its own local plan within that. So there was quite a long discussion about, well, how are you going to map success if everybody's doing their own thing? And it's not easy to do, but maybe there will just be some sort of aggregate score of, well, did Wokingham deliver on theirs? Did West Berks deliver on theirs? Did Reading deliver on theirs? And how does that, and if you looked at it as a whole, how does that leave us, as well as what is genuinely joint? But I also thought it was important that we've really got to get someone who will drive this. It cannot sit on a shelf as a dusty document.
Just quickly add one more point. The proposed legislative changes bringing ICSs formally into being next April means that there'll be another level of strategy making. And there's a certain amount of confusion, certainly in the white paper, I think, between the role of the partnership board and the ICS NHS board, because the way it's written in there is that they're both producing strategies. I think actually, you know, they will be doing different things, and that'll probably be clarified in the legislation. But it does raise the question of how that relates to the health and wellbeing strategy. So we might want to kind of keep an eye on that.
Okay, thank you. Right, now then, is our presenter from Hampshire Hospitals with us, Michelle? Or no? Okay, right. Well, we'll carry on to item 9 then. Community engagement. And although I suppose some of this has been covered, Michelle, you can launch off on CAM's focus group.
Oh, apologies, I was on mute. Just after having a discussion with Andrew and following up really from the report, we thought it might be a good idea to get a small focus group together to again have a look at the report and get some opinions on the report and you know, ways of going forward, really. So it was just a suggestion to bring to the board that that's something that Andrew and I discussed. Obviously, there's been a discussion about having an event for the younger people in a similar way to Thinking Together, but also this report all stems from a focus group that we had back in 2019, I believe. So it'd be quite nice to kind of go back to a focus group again. So yeah, that's what.
Can I just check? The focus group would be with service users, would they? Or
yes, with the service users. Yeah.
Okay, thank you. Carers Week, Carers Survey. Who's talking to that? Alice?
Can you hear me? Yeah, the Carers Week. So during the Carers Week, we sort of did a survey and about how carers felt about sorry, that's the speaker just trying to get hold of me. The carers survey. We didn't have much of a response, so it would be worthwhile. We are planning to put it out again, to asking for carers their view again about the support they're getting.
Okay, thank you.
Can we look to do a little bit more work with Tuvida and potentially Fiona and Age UK, because that might yield us a better response than anyone else in that sector, because I think it's important that because we've got seats at health and well-being at some of these boards, the one thing we don't want to do is dilute the message by them saying, well, no one's filled it in.
Yeah.
Fair enough. And the West Berks Diversity Forum, is that Alice?
Yeah. West Berkshire Diversity Forum. We had our we have had the third one. We are hoping to hold another one soon. But also we are looking at whether to look for some funding to support the forum going forward, because I think we as Healthwatch do feel that that is something, there's a great, it's a good project to do, to hear what are the health inequalities among the ethnically diverse communities.
Yeah, thank you. And maternity forum?
The same thing with maternity as well. No, we are still in conversation. In fact, Zoe is in our board meeting today, kind of thing. So hope we are going to take this conversation forward with the maternity group that's in West Berkshire to see how forward what we can do with the forum and you know, the maternity voice partnership. They are very keen on working with us as well. So this is kind of something, another project that we are hoping to look for funding going forward.
And Alice, that's across both Swindon and Hampshire as well. And this is the gap we've got. Is that while Reading and West Berks maternity voices represent mums who go to RBH, they don't represent anybody else. So we've got this obvious gap with both Hampshire and Great Western. We had the very positive maternity report that went to Health and Wellbeing and detailed that the Hampshire service at some point will be operating West Berks. We had the offer from Great Western if funding was found for it. So if anyone saw the Independent article yesterday, which is basically saying that we're never very far away from another maternity scandal, and this is not isolated. So we have basically got to ensure that maternity remains at top of mind for providers, for health and wellbeing boards, so that something gets done, and inadequate or failing services don't get accepted as the norm.
Yep, thank you. And now we have two surveys, dental and GP. That's you again, Alice, I think. Or has she disappeared?
I'm here. We are still doing, can you hear me? Yeah, we are still doing the dental survey, and hopefully you'll be closing soon. But I know we want the public to complete the dental survey. Regarding, oh God. Regarding the GP survey, we are about to launch a GP survey. What it means is we are going to be looking at how the public engage with the digital, like the website, the emails, and that. Do they find it easy to engage? So that's the plan, and this is part of the work that has been done in Wokingham and in Reading.
Okay, thank you. And continuing health, sorry, Adrian.
Yeah, I just wonder whether there's any scope for working with the PPGs on that. I mean, a number of them are also doing surveys. And I mean, Kamal's point, I can't remember quite which meeting it was at, but was that she thought enough surveying had been done and there were quite a lot of lessons to implement from it. What do we think about that? Do we think there is more still to find out?
I think, we've been, every Healthwatch has done it in their own area, and it would be nice for us to do that, as well as what Kamal suggested. I think that is a two prongs here.
I think Adrian, what we're planning on doing the same questions that were asked to provide the last jigsaw piece to Berkshire West. And then also, I will happily work with the PPGs on this, because it's really, really important that as GPs fundamentally change how they operate with this receptionist-based triage before you get anywhere, and the change of personnel in GPs, the public is not used to it. They're not necessarily being informed about the changes. And it did get picked up, the responses to the survey. So this is where, although people are often surveyed to death, the one thing that I would question is, well, where does the survey go? One of the advantages of working with Healthwatch is we have routes for surveys. I will happily call it a PPG survey aided by Healthwatch, but we have to make sure the right people are hearing it, I think.
Yeah, we've got a patient panel meeting, as you know, next Thursday, and I was going to put digital access on the agenda, not particularly to suggest a survey, but is it possible to hold off till then and see whether they're keen to work together?
Well, absolutely. And I think the other thing we can probably do is get an example of, we've got a sort of template already to go. And I think what might work quite nicely with this is if we said, here's what's proposed, anything you want to add, subtract, or equally, you may say it's complete waste of time. I mean, our rationale is very much, it just gives the last piece of the jigsaw of our health network for both the clinical commissioning group and the ICS as a, no, West Box isn't dramatically different to Reading and Wokingham. So I think we should do it.
So we may be able to use the same questions, perhaps add.
No, that's the point, and then just add in the rural flavour.
Yeah, and get a bigger response if they're helping to put some of them out.
Yeah, absolutely.
Right.
Okay, thank you.
Continuing healthcare is me, Mike.
You, is it? Okay, fine.
Yeah, so this is we were talking about scorecards of where West Berkshire doesn't do very well. Well, this is the granddad of all of them. West Berkshire and the other areas are basically in the bottom 5 for continuing healthcare in terms of the number of residents who receive it. So to give you an indication, Cumbria, I think, is 108 people who get it out of 100,000 population. West Berkshire is 13. And bearing in mind, we have a disproportionate amount of older people in West Berkshire in terms of the population dynamic, you would think it would be the other way around. And what's even more worrying is that within our integrated care system of Bob, even Buckinghamshire is at 56 people per 100,000. So we don't even have any kind of equity just in our own system. And the battles that people undertake in continuing healthcare, it's just something that would, I think, shock people if they weren't aware. So basically, if you are seriously, you do have to be seriously ill just to even start the process, or the person you're looking after. You have to apply for continuing healthcare. You have to jump through endless hoops. And effectively, it would appear that our CCG seem to be operating on how can we go about reducing the numbers of people who receive this rather than their need? And I don't use those words lightly. It seems to be an exercise in finance rather than care. And fortunately, I know that the ICS are looking at this, but my fear is the ICS are looking at Buckingham and going, well, if West Berks can only do 13, why are Bucks doing 56? Perhaps we can get Bucks down to 56 rather than the other way round. So this is a huge problem. And I'm hoping with the help of Fiona's organisation at Age UK Berkshire, the carers groups and various others, we can perhaps take this up. It's just nowhere in terms of people discussing it. I've never heard it discussed.
Is there anything that says what good luck looks like? So what is an expected ratio?
I think this is the problem is that it varies so wildly, and the view was that Bucks didn't have the time to look at applications properly, so basically just rubber stamped almost anything went through, and then West Berks appeared to be at the, or rather Berkshire West appeared to be at the other extreme, you know. And you know, just personally, I've come across cases where, you know, a person was turned down for continuing healthcare and died 3 days later. And the process had been going on for months and months and months. And when you've got health professionals like their GP saying this person should be getting this, you know, it just seems to be a real misconnect. That if your own physicians and what have you are writing in, which is what they have to do to say this person should be getting this, and a body that is sometimes difficult to account for is just turning it down. But I just think it needs some focus. Anyway, we've got some hands up.
Karen, then Martha.
Just to say, it took me 2.5 years to go through the whole process of continuing healthcare. And actually I was supported by Beacon, who are involved in, who I think they're based in Oxford. And it might be worth, they're very, very good. They were funded by the NHS, but have since gone private. They're very very hands-on, and it may be worth getting them to over to talk to us. Age UK support them, and they're fairly well known. But the guy there is very good, so it would be worth speaking to them, I think.
Martha.
Yeah, being questions from members of the public about this, you know, people who like Karen have been involved in it. What is our, it sounds like, you know, it's a very serious issue. I'm just wondering what is our action going to be? Where do we go? What do we do first? Or
well, I think potentially evidence gathering, and I think the other thing is, you know, I'm delighted Fiona's with us today. So I don't know, Fiona, do you want to just quickly chip in on this if you've got any thoughts?
Yeah, I think this is something that is actually becoming a much more significant problem, particularly as we come out of pandemic and more people have realised that over the last year their loved ones have seen a significant steady decrease. And one of the things we found is even the support that we have to give to help people to navigate CHC has probably gone up by around 75%. So that's obviously putting a huge strain on us, but equally the system is not easy to navigate. Beacon in particular are fantastic, and we've worked with them on many occasions. But I know, for example, some people who I would say are the kind of people that are very stoic, very well educated, and very forceful, and they have been struggling with the CHC process for over a year and a half. So it's completely unnecessary. It's completely traumatic. It's traumatic for carers and loved ones. And I do think there's a case for us all joining together on this to see what we can do to try and get some move on it, because it's going to become even more of an issue in the next year to 18 months.
Thank you, Fiona.
Yes, so I think you know, as we mentioned a work plan briefly, Mike, this is a high priority that we haven't actually allocated anything to, and I just think we need to maybe get some research in working with Fiona or with the carers groups as a starting point, and then start asking the questions. Because I think remember, Berkshire West are bottom of the pile in England. And someone surely should be being asked why.
Absolutely. Yeah, we'll do that, Andrew. Okay, I think there's one item left on this. Alice, is that your volunteer update?
Yeah, I mean that nothing has changed. We are still recruiting for volunteers, and you know, and we are, you know, hopefully when we come out of our present situation, we'll be doing a lot more engagement.
Okay, thank you. And are we anywhere further forward with our presentation?
Yes, he's here.
Excellent.
Okay, fine. So we will.
Are we letting him in?
But he was here, and then we lost him. So I'm keeping my eyes out, and I've been in contact with Elizabeth as well. So I will keep trying to get him.
Okay, should we carry on until we've got him, and then jump in, Michelle, if he's here?
So it's West Berkshire Health Scrutiny Committee, Andrew?
Yeah, this is quite exciting, everyone. In line with local government policy, West Berkshire Council is meant to have a health scrutiny board and hasn't. There's also a joint scrutiny board, health scrutiny board, being created for the Bucks, Oxon, Berkshire West integrated care system. That's almost ready to go. So there is a committee that has been formed in West Berkshire. What they've asked us to do is have a standing item on the board that we can take to them, but also, and I have to take my hat off to Claire Rolls, who's arranging this, who's a councillor from Hungerford. They've very much said that although that's the sort of ideal model, they are happy for us to stay within the meeting and comment or be asked questions throughout, because obviously we're only really meant to talk about perhaps one item, but the Health Scrutiny Board will be going through all sorts of different things. And you'll be pleased to know that dental is on the agenda for the first meeting, and potentially our COVID report as well. So I've been very impressed with the speed and the way it's been put together. It's got cross-party membership, as most of the council committees do. So I'll report back once I've been to one of the meetings. I think they're held in public. Martha may know better than me, but
I'm not sure about that.
Okay.
You know, I'm not on it because I can't be on it because I'm on Health and Wellbeing Board. So
yeah,
but yes, it's cross-party, but I'm not too sure about whether it's in public.
Okay, well, we'll wait and see, and it'll be something we would certainly encourage in terms of transparency and involving the public. So let's see. So that's all I've got to say on that, Mike.
Thank you. Item 11, Stp Ics update.
Again, Amanda may know more than any of us, but in theory, the new boundaries are being drawn up for our Bob ICS that may involve East Berkshire, that may involve other bits of Frimley, or perhaps a Catalan-like coup, where Berkshire West heads off with East Berkshire and forms its own ICS. We don't really know. It's meant to be being announced imminently, so I don't know, Amanda, if you've got any inside intel.
No, I don't. I'm afraid. No, apologies.
Okay, so that is going to have a significant impact on us locally, and until we actually know what's happening, it may be a watching brief, but we just want it raised so that the public understand its significance, because the money is going into the ICS, so it will no longer be going into the local clinical commissioning group. So we're fortunately, we are mentioned in all the legislative processes as a body, so, and we are in touch with the ICS, so it does look like we are being included either with representatives of all the local Healthwatch, or in some cases more than one Healthwatch sitting in there. So again, feeds back to that narrative about how important it is that the public comes to us with their feedback, their issues and their problems.
I assume that there would have to be a recruitment for a new chief officer under those circumstances.
I think all the existing staff are reapplying for various posts, and there seems to be lots of new job descriptions going round. They changed the representative at the Health and Wellbeing Board this morning to someone else. So yes, it does seem to be wheels within wheels.
Yes. Fine. Anyone? No? Okay. The work plan we have talked about, Andrew, but
I think again, Mike, all I want to do is try and get this finalised this week and published, because I think it was finalised, and I'm not quite sure why.
Yeah. Okay.
We haven't got this agreed. So if the board is happy, we will circulate what I consider to be the final document for this year, because we're months late on this, and just we can amend it as we go, but let's have a final agreed document, I think.
Okay. And do we have any update on Hampshire? No, so should we bat on?
No, apologies. I'm still, I've messaged Elizabeth again. I haven't heard anything back yet. I don't know if Alice has heard anything yet.
Okay, well, we'll...
Michelle, can we ring them while you're...
Yeah, I have rung Alice.
Okay.
I have rung Elizabeth to let her know, but I'll keep trying.
Okay, thank you.
Okay, then, well, item 13, patient data, which is a very interesting hot topic, I think. So is this you, Andrew?
Well, I think we felt we should put this on the agenda because of obviously all the details about the GP health data that was meant to all be gathered in and delivered, I think by the 3rd of July, they said, where basically everyone's data, and it was very much on the basis of you had to opt out rather than opt in. And various commentators were concerned that while in principle it was being used for research, working out where need was, how data could help even with diagnoses and potential treatments. There was also the more sinister side of whether anonymity could be got round, even though the data in theory didn't name individual people, but whether insurance companies could utilize it with clever algorithms. None of these have been answered, and we were pleased that the data grab was suspended until September. But there are absolutely two sides to this, which is all the positive stuff which we talked about, you know, because it has been big data that came up with one of the treatments for COVID, where they started to realize that enough people were reacting positively. I'm sure Amanda can tell me which drug it was. I don't want to say the wrong one and get people.
Dexamethasone.
That's the one. It's really hard to say, and it has nothing to do with bleach products. Yeah, so Amanda, I think you probably know as much as anyone on this. If
well, look, you know, my thoughts are that I'm delighted that the consultation and the chance for the public to understand this in more detail is being extended to September, I believe. So I think it's up to us to make sure that we publicise it. And I think there are obviously real concerns, but also real benefits. Because as you say, you know, Martin Landry is the chief investigator of the recovery trial out of Oxford, and a lot of the benefits and a lot of the things that we've managed to do as a country have been based on this. And I know that in the right circumstances, my understanding is that many patients want their data to be used for research and things. They just need to make sure that it's being, you know, managed properly and used for the right things, and that the way that it's being used is not going to put their individual data at risk. So I think the consultation didn't. I was personally really surprised that it was so low key, given some of the, you know, previous poor comms on this in you know 3 or 4 years ago. So I think the fact that it has been extended means that there can be some enough time for people to consider whether they want to opt out or not. But my view is that it's more about us having a balanced view and just making sure that patients have a chance to understand the situation and not really say one way or the other, whether it's a good thing or a bad thing. We may all have individual perspectives, but I think it's more important that people just are part of the consultation.
Thank you, Amanda. Anything else you wish to say on that, Andrew?
I think the other thing that was problematic for lots of people as well is that there was potentially 2 asks on data. So if you wanted to opt out, you had to fill in a form that had to be sent to your GP, but then you also had to opt out of the NHS digital as well, was my understanding. So certainly this assumed opt-in for something that's relatively complex, I think should absolutely be pulled up. And I think there was talk about there being one central opt-in, opt-out that would cover everything, rather than this piecemeal, this bit or that bit. Yeah, so Karen, I note that you've mentioned as a patient data workshop on Wednesday the 7th. Is that July?
Yeah.
Yes.
And can we publicise the link for that?
Yes.
So if I can get Michelle and Nathan to take a note, if you can, I mean, if you can find the link, Karen, pop it in the chat.
I have sent an email around to everyone earlier, an invite which has got all the information on it.
Okay. Well, we'll make sure that goes out on our social media channels as well. But I think the other thing that we briefly talked about was whether at either a subsequent board meeting or even possibly an event, perhaps we need to talk to the CCG about this as to, does this need something doing? And Adrian, I know you've got your hand up with the patient panel groups as well. So Adrian, do you want to come in on this?
Yeah, I mean, I think it is a little bit worrying. I mean, it's more the principle rather than a lot of very firm risks about individuals. But I think what I would like would be for them to do it, but to do it properly, and to have more security about who the data goes to and under what circumstances. I mean, as I understand it, it's going to be made available to private companies at cost price. And one of the arguments I've seen, I don't know if this is valid or not, is that it could lead to treatments being developed, which are then charged back to patients and the NHS. I don't know if that's correct or not. One question I had, based on what you were saying, Amanda, has there been a consultation on this?
I'm picking this up as well, and I do, you know, I think I should probably, I wasn't expecting to be asked my opinion directly on it. So, you know, I work for a pharmaceutical company, so I have to declare a conflict of interest, really. I don't think, no, personally, knowing how research is done in a very collaborative way. And, you know, if you look at investment in research by the public sector and by the private sector, the majority is carried out by the private sector. And I'm very aware of how much we do get charged for data. I don't know the detail of it, and I don't think it's up to me. I don't think I should be talking on this topic. I do think, however, that the note that Karen sent round, I think it's Karen or Leslie sent round, shows that the AHSN, the Academic Health Science Network in Oxford, is trying to create a community of public interest on this. And I think that is the right thing to do. So basically, it's a workshop on 7th of July to discuss experiences and views. There'll be presentations to help frame the conversations. And the idea is to create a community of interest amongst the public in Oxford and Berkshire area regarding the use of patient data to really sort of impact, promote and champion the changes happening in your area. But I think this is a really good opportunity to get the detail on it, because I think that's where we'll be able to ask the right questions and understand the level of consultation. That's my view.
I think you're right. The main thing is to shine a light on it and let people decide. Yeah.
Okay, thank you. Waiting list.
Karen's got a hand up.
Sorry, Karen.
Sorry. One of the difficulties at the moment is the confusion that there is between the patient collecting patient data for use, countrywide use, and the connected care and using our data, so that our information, so that if particularly it's important for us, if we in Berkshire go to Swindon or to another hospital, it's about our care records going with us. And unfortunately, it's quite difficult because there are the two things going ahead at the same time, which I think is going to confuse a lot of people. And a lot of people are opting out really without understanding what the whole situation is. And in terms of using our data, if a lot of people opt out, there's no point in using the data because it won't be significant enough. So there are huge difficulties. And some of the meetings I've been to be quite honest, I don't understand what they're talking about. And I'm not actually stupid, but it is very complex. So any help that we can give, understanding that there are two things going on at the same time, does make it difficult.
Mm-hmm.
I think we need to go back to the CCG as well, and perhaps Adrian, will this be on the radar of the PPG meeting as well? Oh, it's gone back.
It is.
Anyway.
Adrian, did you hear Andrew's comment?
Not sure he did.
Looks like he's not
He's
here.
unmuted. Adrian, did you hear what I said about it being raised at PPG?
No, sorry, I didn't. My connection just dropped.
Yeah, no, I wondered whether this whole data question will be raised at your meeting, and again,
yes.
whether we need to find someone who can answer some of these questions: reconnected care, the national asks, the national research, and how the heck we're going to explain this to the public.
Yeah, it's on the agenda for next week.
Excellent.
But with someone that has the background and understanding to answer the questions, because that's what I'm concerned about. You need someone from the CCG there that can say categorically, this is how it will be used, or this is how it isn't, that actually knows what the consultation is. Otherwise, we're not doing that in a way that is supporting good decision making.
Sorry, I've moved my where I operate from to be right next to the router so that I wouldn't lose it, and it's obviously not worked.
I was just saying that I felt that you need to have someone there that understands how the consultation is being done and what some of the answers are, in order that we can have to ensure that we're allowing the public to make informed decisions, rather than, I think all of us in this room are not informed and therefore cannot I think we should be making sure that we're enabling clear conversations rather than building concern when because some of the language that we've used today, I think, has been quite strong, both maybe from my side, but also from others in the room. So I just think it's important that if we are going to do something, we make sure that we get an expert from the CCG or from someone who's involved in public health or the data collection piece to be helping the public understand this, rather than just kind of asking a lot of questions without helping people understand it. And that's why I think that meeting sounded quite good, that was sent round. Maybe that's a biased view. Apologies if it is.
No, certainly. I mean, I think we need an informed view. I mean, for the patient panel, we'll have Kamal Bayer, who's leading on digital inclusion across Bob, but I don't know how much, I don't think she's been particularly involved in the patient records, in this aspect of the patient records thing. So it may be that we need to, not necessarily at that meeting, but perhaps depending what's discussed afterwards, get some more expert input into it.
I think Adrian, the other thing we can probably do, we can probably put an ask into the CCG or NHS Digital to say help, or Healthwatch England.
Yeah.
Karen?
I was at a meeting last week where Sian from the HSN was unpacking things. So I don't know whether she might be available, but she actually put a paper, which she may share, where she tried to put it down, but she was having problems, difficulties with understanding it too. So trying to get somebody who really, I think it's going to be very hard.
Yeah, that's the trouble with this kind of policy. Yeah.
Adrian, you've got Sian's contact. You could perhaps ask her if she may be able to come to the meeting.
Yeah.
Okay, thank you. Let's move on to waiting lists then. Andrew?
Yeah, I think not dissimilar really to our previous conversations. Obviously, we've got, according to all the figures I've seen, record waiting lists. And this is something we just haven't had to deal with as an organisation, because since I started, waiting lists have, generally speaking, mostly been reducing rather than increasing. And the increase at the moment, depending on which report you read, there's medics saying it'll take them 10 years to catch up. So I just think it's just something that, wasn't, funnily enough, on our work plan because it hadn't cropped up. But, what's the board's thoughts on what we as an organisation should be doing or looking at with this? Karen?
You say that though, but recently I've had experience of a close friend who's, if you go through the NHS, to get a cataract appointment can take you up to 6 months. But in fact, he was referred and he could have had umpteen, got in the next week, and could have had umpteen appointments because he actually changed it, and could have had it the next day, or certainly he got one the next week, by going to a private hospital paid for on the NHS. So I think some of this needs looking into.
It does, but Karen, it still doesn't get over the fact that the national figures are the national figures. Yes, Choose and Book does offer you this, and there are mitigations being put in place via the private sector being utilised by the NHS.
This wasn't Choose and Book, this was Specsavers making a referral.
Yeah, it's okay. I'm delighted it happened, but
I don't think anyone's disputing that the UK has a tremendous issue with waiting lists post-COVID, and that's, you know, that's the most serious piece, and it is absolutely immense, and at the rate it's going, it'll take 10 years to solve. So what is it exactly, Andrew, that you feel we should be doing?
Well, again, this is put on the agenda really as a sort of discussion point, because, as I said, it's never been in the state we're in. On one hand, we're talking about COVID recovery and what have you, and yet there is this enormous backlog, and that's before you get into workforce challenges, burnout challenges. So almost 18 months, the entire world we're operating in has been turned utterly upside down, and we've never been in this position before. But really, it's trying to understand, well, what should we be doing about it? You know, should we be talking to the groups who are suffering at the sharp end of this to find out what might help, whether they even know, is it having an impact? As I said, it's very much really that it would be remiss of us not to be discussing this in some form or another at this time.
Yeah.
Okay.
No, I just to add there, I completely agree with you. It is one of the things that is going to be impacting the people of West Berkshire, and it is also going to be impacting them in an inequitable way, depending on their ability to navigate the system as well. And I'm just trying to think about what it is that we could have and think about, because this is obviously going to be a national challenge and a local challenge. And I would have thought there would be a plan at a national level, but also at a local level to tackle waiting lists.
Yeah.
And maybe we should look at it.
Well, I was just wondering what Healthwatch nationally is saying.
Mm.
Yeah, what's their view? What's the messages coming from them? They must be talking to us and saying, waiting times, you know, this is what we might be doing.
I think it's so kind of new, the headline, that I don't, apart from just passing on the news, I don't think they formulated anything.
Right.
But
Okay.
I think that's a good shout for us to go back to them and say, right then.
What role is Healthwatch going to play?
Yes,
Yeah.
Quite.
Adrian?
Yeah, so we should action that as a point.
I was just going to say, you know, I think probably the NHS is very aware of the problem and they're doing everything they can about it. The only issue would be what you raised earlier, whether some bits aren't getting the attention they ought to have.
Okay, Karen, you're...
But there do seem to be ways round the system if you know how to navigate it. And I think we need to look into a bit more about referrals and how they're made, because it seems that some GPs are reluctant to refer things some ways, and they've got their own way of doing things. And do they know that you can get around the system?
Well, if you don't have enough theatre hours available or enough staff to actually fill the theatres, it's...
But the NHS can buy them in, but are they?
I think, you know, there is a massive plan and they've got a certain amount of investment. Chris Hobson, the chair of NHS providers, or whatever it's called, has been calling this out for the last goodness knows how long. And I think there are two discrete problems. One is the absolute ability of the NHS to manage the waiting list, and then the other one is whether or not there is, you know, different ways and different parts of the country are being able to navigate it better. But that's always been there. Whereas this absolute crisis is about the scale of getting, you know, the hundreds of something like is it 3% of the population are on or waiting for more than a year or something for appointments and things like that. You know, the figures are really, really concerning, and I would imagine there will be a national view and then a breakdown of that local view that says, you know, what percent of our population are waiting. And I do think that this is so big, it's the big problem for the NHS. and therefore we need to understand what Healthwatch is doing. Otherwise, we're just going to be, we're not going to be helping, we're going to be hindering. And I think we need to understand it in the bigger scheme of things. But I do think we have a voice, and I just want to understand what, I think our job is to decide what voice we have and what we need to look out for, because we can't solve it.
Agree.
Fine, right. What do we do now, Andrew? Are we going to? I think there's no sign of Hampshire is there. Let's.
No. So sadly, he's having very big technical issues. He appears. I let him in, and then he disappears again. I've sent him another way of getting in, but it doesn't seem that he is able to get in at the moment. He has agreed to speak at our next board meeting if he can't come in on this one.
I'm wondering if this is the great NHS IG security issue of them not being able to use Zoom.
It could be. He, like I said, he's saying on his end that it's saying connecting and then he doesn't connect. But obviously on my end, I've seen him, I've let him in, and then he just disappears again. So I've sent him another way of getting in, but I don't think he's. I think he's
there is
really
an issue with
NHS he does send apologies.
I don't think we should carry on waiting. I think he can defer him to the next.
I agree, and let's potentially look at doing the next one on Teams, perhaps if we've got an NHS visitor, perhaps.
Okay.
Okay, fine.
Thanks.
Okay, we now move on to questions from the public. I don't think we had any written questions in, and I can only see one member of the public. I can't see anybody at the moment in the meeting, which is David. So David, I don't know.
Hello.
You can hear us, yeah?
I can hear you, and I can speak to you if you want me to.
Please do, if you've got a question around our fairly broad agenda today.
No, I've very much appreciated listening to you. I think I would like to compliment Michelle Pace on actually helping me to understand what Healthwatch is about, because she encouraged me to go and look at the national website. What I would like to feed back to you from a personal point of view is that I was under the misapprehension from one of your leaflets on advocacy that you were doing personal advocacy for people in Reading. And I really needed personal advocacy at the time. I probably still do, but I wasted a lot of time because I didn't realise that you were a national organisation with a name like Healthwatch. And the name Healthwatch wasn't very helpful to me because it made me think that you were on the lookout for individuals to provide advocacy for. Okay, so
yeah.
When you actually put out any leaflets or anything about what you're being an advocacy service, I've actually been sharing with, because I'm a Sikh, I've been sharing lots of things, the good things you've been doing with the Reading Sangat WhatsApp group, for instance, about Alzheimer's and things like that. So they know about things thanks to your newsletter. But it's actually only in the last 2 days when I tried to put a question to Michelle, to submit, that I actually realized you were a national organization and not a local charity that were claiming to do advocacy for the people of Reading. So I wasted a lot of time. I needed that. I need to find other ways of doing it. But I very much appreciate the work you are doing. But just please be aware of the need to communicate, especially with a name like Healthwatch, which makes it sound as though, though the National Health does a great amount of sterling work, as we've seen under COVID, and exposing themselves to all sorts of risks and worries, that's appreciated. It is wrong to actually maintain that when you try to do good, you can do no harm. You always have as an organization always has ways it falls down on procedures and what have you. You know, sorry, I've slightly lost my thread now, but you know, when you actually have a name like Healthwatch, it's important to make it absolutely clear what you're doing, and it would be really good to have some advocacy in the community in Reading, because I did try to get advocacy within a hospital when I felt I was being wrongly treated, and I was refused. They neglected to give me care plans when I requested them. They neglected to, I'm not going to name it online, it would be inappropriate, but they neglected to let me see a senior. They didn't have anything on complaints at reception. And in fact, I have lost over £200,000 of money because they split me up from a partner because a psychiatrist started with the words, "Let's not bother about that." So I actually feel as though I needed advocacy from an advocacy service, but there doesn't seem to be an advocacy service for people outside of hospital. And if they avoid giving care plans and letting you see a senior and don't have anything on complaints procedures when you feel you're being abused, it is really bad.
Thank you, David.
Okay, so I've made my point.
Thank you, David.
Oh, one other thing. When at a previous meeting, I actually made the point, there's no such thing as mental illness, and someone actually dismissed what I said as a matter of philosophy. No, it's not. To me, it is personal, because I've been described as mentally ill when I wasn't, because they couldn't understand that I'm a different sort of person. So it's prejudice to say a person's ill when you don't know it's an illness. We have known physical illnesses and we have unknown physical illnesses. But just because the system requires people to be labelled as mentally ill to get benefits and that is no reason to maintain this. And just to say there's stigma in the system is wrong. The stigma is in, just imagine, even if you don't agree with me, imagine what it's like to be told to be dismissed as mentally ill when you're not. And that is what the Russians did with sluggish schizophrenia. So I just ask everyone to bear in mind that it is prejudice to assume if someone has an illness that you do not know the cause of. You can suspect one, but you can't do anything else. And why not have some doubt?
Okay, thank you, David.
Thank you. I've made my point. Have a very nice day. You're doing a good job. You're doing a good job.
Thank you.
Bye.
Okay, there are no other questions that I can see. So we will move on to any other business. Board members, do we have any other business? Not a hand in sight. Plenty of shaking heads. I take it there is no any other business. And we have a date for the next meeting, I think, Michelle, do we not?
We did in September. It's whether you still want to keep it in September with this one obviously being at the beginning of July. I'm going to wait to see, obviously, once the restrictions are lifted, hopefully in a couple of weeks, whether we can do the next one as a face-to-face.
Well, I hope so. In a sense, we pushed this one back, hoping that it would be past the we're semi back to normal date, but of course that didn't work out. So yes, it would be nice to be able to meet in person, but if we cannot, we cannot.
Can you tell us what that date is? I haven't got that in my diary.
Yeah, if you give me 1 second, I'll have a look.
6th, is it? September the 6th?
Yeah,
Yeah,
got it
11
down as
o'clock.
September the 6th. Yeah.
What time?
11
11.
o'clock.
Thanks.
Alice?
Can I just say that our annual report is out, but also, not often does our chief officer get credit for this, but he's really, really worked hard at this report. So I think we need to acknowledge that. And I'm going to say thank you very much for doing an amazing report.
Well done.
Absolutely, Andrew.
Thanks, Alice.
Thank
Thank you, everyone. Team effort always.
You ate a lot of frogs, Andrew.
Lots and lots of eating frogs.
Will we hear much from Healthwatch England, what do you think? Or will they simply say, we got it?
They've already said they've got it. So we basically fulfilled our statutory duty. The local authority have had it. It's on our website. But what I think we will be doing is we need to formally launch it. So 2 years ago, if you remember, we all did the bandstand, and we may end up asking you to print the front cover and standing COVID-free somewhere or near someone. I think it may be a watching brief, or maybe we just do the bizarre 6 feet apart thing at a suitable location if anyone has any suggestions, so we can put it out in the press release. I was really pleased the Health and Wellbeing Board have agreed to add it to their meetings agenda just as an information item, but at least it means it again gets acknowledged and broadcast, and thanks to Nathan for keeping the digital stuff moving as well. Yeah, I mean, the problem we've got is we've got a plethora of really good reports that have sort of somewhat shunted up to each other, partly because of the pre-election period in May. It really does interfere with our work, and it would be lovely if Healthwatch England could do some lobbying to get us out of that. Because then we could space things apart and actually make sure that each one of them receives the attention it really deserves. But again, huge thanks to the board, huge thanks to everyone who's taken part, and I think Hampshire need new Wi-Fi.
Yes.
As part of their new hospital.
My thanks to everyone at Healthwatch and to the board.
Lovely. I think we're done.
Thank you. And the meeting closed, therefore.
Thanks, everyone. Take care.
Thanks. Bye.
Bye. Thank you.
Thank you.